Hello, my name is Wajaha, and today we're going to cover epiglottitis. So let's get started. Now, the epiglottis is a flap of cartilage, as you can see here, at the top of the larynx. And when breathing, it allows air to go into the trachea and down into the lungs. And when swallowing, it protects the trachea from aspiration, so food goes down the back into the esophagus only. Now, epiglottitis is inflammation of the epiglottis, and it can affect both children and adults, but particularly those who are unvaccinated, and I'll go into more detail about that. If left untreated, it can lead to airway obstruction, so it's really important that we can recognize this early and treat it appropriately, and we'll cover all of that today. So moving on to the cause, most commonly is Haemophilus influenza type B, and it's really important to remember this because it comes up in exams time and time again. There are some other causes, and I've split them up into different categories: bacterial, Streptococcus pneumoniae; viral, we've got parainfluenza, which also causes croup; varicella zoster, which causes chickenpox; and herpes simplex. And fungal, we've got Candida albicans, and you may commonly see this in HIV patients. There are some non-infectious causes as well, things like foreign objects, trauma, smoking, and thermal damage, things such as very high temperatures. Now, it's really important that when we see these patients, we ask about their vaccination history, and that's because Haemophilus influenza is vaccinated against. And if you look at this picture, you can see there's quite a few of these 6-in-1 vaccines. One of the 6 is Haemophilus influenza type B. And because of the vaccines available, the incidence of epiglottitis has significantly reduced in the UK. And I think in the States as well, there's been a 95% reduction since the vaccines come out. Epiglottitis can be classified into 3 different subtypes. We've got class 1, in which there's quite mild swelling; class 2, in which there's moderate swelling; and class 3, quite severe, when we can only see less than 50% of the vocal cord as well. There are some symptoms that can be present with this condition. It usually begins with a fever and a sore throat. And as the inflammation progresses, it can lead to dysphagia, which is difficult swallowing, and adenophagia, which is painful swallowing. They may also have a muffled or hoarse voice, and drooling and stridor, which are quite severe signs. You may also notice that the patient is sat leaning forward and upright, and that's just to help them with their breathing, and this is often called the tripod position. So quite a lot of symptoms, but don't worry, I'll help you all remember this once we cover the rest. So how do we investigate this? It's really important that we, first of all, try not to examine the upper airway, as that can lead to complete obstruction. And so what we like to do normally is call for senior help, arrange a laryngoscopy, which is like a camera test that goes down the mouth, down into the larynx, that helps you see the epiglottis. And you may see, like I've written, a beefy red epiglottis appearance. To add to this, we may also do an X-ray, and as you can see over here, these arrows are pointing to the epiglottis, which is quite thickened. This is called the thumbprint sign. And then we also do blood cultures to try and help find the causative organism. Treatment-wise, always the first thing to do, never ever to delay, is to secure the airway, and that's because of airway obstruction, is something that we really need to avoid. And we can do this by nasotracheal intubation, as the picture shows, and we normally do this straight away, straight after the laryngoscopy. In emergencies, we may do a cricothyrotomy or a tracheotomy. A cricothyrotomy is an incision through the cricothyroid membrane just below the Adam's apple, and we do that just to establish the airway. IV antibiotics such as ceftriaxone are usually prescribed, although there may be some differences based on your hospital trust. And then we give corticosteroids that can help with some of the inflammation as well. So that's quite a lot of information, quite hard to remember that all, but I've got a phrase that will help you remember everything that you need to know. So when you think of epiglottitis, what I want you to remember is: small humans struggle to do much occupying large igloos. Let's break this down. Sore throat, Haemophilus influenza, which is the most common cause. We've got stridor, the tripod position, drooling, muffled voice, adenophagia, and then we do laryngoscopy, and intubate the patient. Right, if you remember this phrase, you can remember all of the different things that you need to know about this condition. I hope that helps. Right, lastly, just to finish things off, here's a question. You're working as an FY1 in the emergency department when you attend a mother and her 4-year-old child. She complains that her child has had a sore throat, which has rapidly become worse over the last 3 hours, a high fever, and has begun drooling from the sides of his mouth. His mother admits that he has missed some of his vaccinations, as she read a story on their negative effects, but is unsure which were omitted. On examination, the child is sitting on the examination couch leaning forward and refusing to move. He's pyrexia with overt drooling from the sides of his mouth. He's refusing to talk, and a soft high-pitched sound is just audible on inspiration. What is the most likely causative agent underlying this child's condition? So let's break it down. We've got quite a young child with a sore throat, a fever, and is drooling. He's missed some of his vaccinations, which probably could be the 6-in-1 vaccine. He's leaning forward, and that's what I think, the tripod position, and he's also got a soft high-pitched sound, which could be this stridor. We know that this has to be epiglottitis, and as I mentioned before, what is the most common cause? Haemophilus influenza type B. So I hope that helped. Thank you very much for listening. Please like, comment and subscribe, and I'll be back with another video soon.